Good evening. This is a special event that we have put together this evening to talk about sleep. And to give us that talk and to answer our questions, we have with us Dr. Shantanu Nagarkatti. And my name is Sam Subramaniam. For those of you who are seeing me for the first time, hi, I run Brand Capital. I didn't bother to introduce myself because many of you have seen me around. But for those who have joined anew or are seeing me for the first time during this lockdown on video, hi. So I'm going to kick off this evening with a quick introduction of Dr. Nagarkatti, and then I'll invite Doctor to give us a few remarks for 30 minutes or so. And then please feel free to prepare your questions in your mind, and then we'll open it up for questions, and you can ask Doctor your questions directly. Okay, so let me first give a little background about Doctor. Doctor is someone close to me. We have worked together on the Brand Capital team for more than about two and a half years at the moment, and I see he's a permanent fixture on the Brand Capital Bombay team. He's there with us, with all of us, advising us, talking to us. A lot of the advice Doctor shares are around healthcare deals, things that could be linked to hospitals, pharmaceutical companies, sometimes alternate therapies, sometimes path labs and testing and this sort of stuff. And most recently, when we worked on a deal on telemedicine, Doctor worked closely with us. So Doctor generally advises us, gives us ideas, market trends, and this sort of stuff. And then he also warns us when we are going down a path in an area where we may not have that much knowledge or information, and he'll give us some warnings and some useful advice. And last but not least, Doctor introduces us in situations to promoters of companies who he's quite connected to, so we may explore a potential Brand Capital deal. So Doctor's been an important fixture in the Brand Capital team for 15 years now, and I've had the benefit of working with Doctor for around a little under 3 years, and I'm very thankful for that. Let me rewind and give a little background about Doctor himself. He's a trained physician. He went to Grant Medical College in Bombay, and he was an honorary assistant surgeon at the JJ Group of hospitals. He still does surgeries on a regular basis when he's in Bombay. So he'll finish his surgeries and come back to the office in the afternoon. So many days he'll tell us it was a rough surgery day today, things of that nature. And he is a student of, like I mentioned, Grant Medical College, and he is a herniologist and a proctologist. I don't know the details beyond those terminologies. I would assume it has to do with the gastrointestinal system, where he's an expert, and he does surgeries there as well. And Doctor, the other part of Doctor, beyond allopathy, he's a trained and he's a scholar in the areas of spirituality. He is a ardent scholar. He reads a lot, the Upanishads, Bhagavad Gita, Yoga Sutras, Puranas. And Doctor and I have had several discussions around these things from time to time outside of office hours, and I've learned quite a bit. Doctor has taught me patience, which is very important for success in any business at any time, especially during these kind of COVID times now. Patience is very important. And I'm a little impatient. Everybody knows that. I know that. I'm working on it. But Doctor has helped me quite a bit. So with that introduction, I will invite Doctor to share some remarks for 30 minutes or so. Doctor's going to talk to us about sleep, the importance of sleep, especially in today's context. I mean, generally, and in today's context. I remember a doctor sent me an article around 7-8 months ago about sleep, and Siva and I discussed that at some length, and I did increase my sleep by an hour per night soon after that, and I'm thankful for it. So Doctor, we're all ready, keen, and eager to hear your advice. Over to you.
So thank you everybody for being here today. And thank you, those of you who sent your questions in. I have carefully studied all your questions, and I've tried to structure the talk so that it answers most of the questions. But the format is that I'm going to give you a short but quick presentation on the importance of sleep. And following that, I'm going to answer the questions one by one. Those of you who have questions are welcome to ask questions online. And I already have those questions of the people who have submitted them. So I think I'll start with the presentation, and I hope you can see the slideshow.
Yes.
Can you see the presentation?
Yes,
Right.
we are able to see. Yes.
Right, thank you. So I'm going to speak about the importance of sleep, and the importance of sleep is that it is one of the three foundations of good health. So one foundation is eating the right foods. The second foundation is exercising appropriately. And the third foundation is sleep. And sleep is perhaps the most important of all of them, because very little is said about sleep. Science says very little about sleep. Your doctor says very little about sleep. But we need to understand sleep very well, because if we do without sleep, we expose ourselves to a lot of risk. First and foremost, I'd like you to understand that sleep and death are very similar. And it's also a choice you have between these two. That if you sleep enough, that's great. But if you don't sleep enough, then death is your constant companion. So as Homer said in this slide which I'm showing you, sleep and death are twin brothers. So how much sleep is sleep deprivation? Those of you who are sleeping 6 hours or less, consider yourself to be sleep deprived. But you are not alone. About 35% of the developed world is also sleep deprived. So that before we had this COVID epidemic, we have an epidemic of sleep deprivation. The first and most obvious impact of having sleep deprivation is mental illness. There is hardly a mental illness which is not accompanied by sleep disturbance. And if you are sleep deprived, then mental illness is, if not your companion already, it is knocking very vigorously on your door. So mental illness ranging from simple irritation, going on to depression, anxiety, and then going on to the more serious psychotic disorders. All of them have some basis in sleep deprivation or lack of sleep. The most visible sign of sleep deprivation, for lack of sleep, if you're sleeping 6 hours or less, is that you will find that you are hungry. Your hunger is directly related to your lack of sleep. And the more you lack sleep, the hungrier you are. And most unfortunately, this hunger that you have is for all the wrong foods. So you're attracted to sugary foods, you're attracted to fatty foods, you're attracted to high caloric foods. And if you are suffering from sleep deprivation, that is sleeping less than 6 hours, it is very, very unlikely that your body mass index is in the normal range. It's very likely instead that you are already overweight, and chances are that you may be heading towards obesity. So you may do all you want, try all the diets you want, do everything, but if you're not sleeping enough, you will have a very, very difficult time controlling both your weight as well as your diet. As a matter of fact, lack of sleep also throws your whole metabolic system in disorder. And, you know, even if you had disturbance in sleep for even as little as a week, and you're a young person, still, if you do your sugars, you will find that you are thrown from normal into the pre-diabetic range. And if you are having chronic deprivation of sleep, then of course you head into diabetes. And if you're already having diabetes, then lack of sleep will make it very difficult for you to control this illness. The first thing that goes up will be your blood pressure, because your blood pressure will go up largely as a result of not having adequate sleep, because sleep is a great restorative. Just like there is no one reason for remaining awake, there is no one reason for going to sleep. But there are so many good reasons, and all of them are concerned with your mental and your physical health. So if you don't sleep enough, your blood pressure will be one of the first signs that your health is suffering. You will also find that for people who don't sleep sufficiently, especially if you're over the age of 40, 45, your risk of heart attacks goes up almost 5 times. This is a huge amount. And therefore, it is absolutely imperative that you must take rest. And that rest should be, as we will discuss, for 8 hours every night. Similarly, with your blood pressure going up, with your weight going up, with your sugar getting out of whack, with the increase of heart disease, there is also increase of cerebrovascular disease or the incidence of stroke. And this is another terrible illness which is a Damocles sword hanging over the heads of those who are not getting sufficient sleep. In COVID times, I must tell you that if you are not getting sufficient sleep, your immune system is becoming inactivated. So this is the cycle which shows you how your immune system becomes inactivated. And as your immune system gets inactivated, as you become immunosuppressed, as there is the reduction of your killer cell activity, as the cortisol levels are raised, you become susceptible to infectious diseases and cancers. And by becoming susceptible to infectious diseases, I want you to remember this one disease, which it's very difficult for you to forget, COVID-19. Among the audience that is watching this program, 1/3 of people, or perhaps a little more than 1/3 of people, are not sleeping 6 hours every day, sleeping more than 8 hours every day. And those of you who are sleeping less than 6 hours every day, you are the most likely to be struck by COVID because your immune system is suppressed. So take a good look at COVID-19 and realize that if you get sufficient sleep, you are running the greater risk of COVID than your neighbor who's probably getting his 8-9 hours of sleep every day. Similarly, cancer results from immunosuppression. And as your system gets suppressed chronically over a period of time, you increase your risk of getting cancers. And if that's not enough, my friends, think of your brain. Because the less sleep you have, you exponentially increase the risk of your getting Alzheimer's disease. And well, when Alzheimer's disease strikes you, you're no longer you. You can't remember anything. You can't remember anybody. In fact, you cease to be what you are. And you become completely dysfunctional. So I suppose this should be a sufficient warning and sufficient threat for all of you to get sufficient sleep. But even if you are not fazed by the idea of Alzheimer's, you should realize that a lack of sleep has a terrific effect on your reproductive system. Those of you who are watching this presentation and who are also battling infertility should realize that lack of sleep is the #1 stressor that leads to infertility. So, especially for women, it leads to cycles, menstrual cycles that are not regular. It leads to problems in ovulation, and of course, it leads to infertility. So, this is also one of the major effects of lack of sleep. And for those of you who are concerned, men should concern themselves with the fact that if you don't get sufficient sleep, as the picture shows, your testis will shrink, your testosterone output will decrease. All this will be the result of lack of sleep. So the answer is you need to sleep, and you need to sleep sufficiently, you need to sleep adequately. And if you don't get sufficient, adequate, quality sleep, natural sleep, then you're subject to all the illnesses that we talked about so far. How much sleep do you need? Well, let's look at it from the age. From children from 4 to 11, they need, as this picture says, 12 to 15 hours of sleep every day. Your teenagers also require 8 to 10 hours of sleep every day. Those of you who probably fit into this bracket and who are watching this program need 7 to 9 hours of sleep every day. And those who are over the age of 65, even they require at least 7 to 8 hours of sleep every day. The important thing to realize is that all of us, we have a circadian cycle. We have a circadian rhythm. And it's not that you can take sleep any time of the day or any time of the night. Sleep has a natural cycle within you. Even if you are closed up in a room where there is no sunlight, even if you're closed up in a room where there is no watch or no clock, your body has its cycle. And this is an example of the sleep and wake cycle. So your body is told to sleep at a specific time. It goes through the period of sleep. You then begin to wake. And after a certain cycle of wakefulness, your body needs to sleep. So it's very unfortunate for those who have to work night shifts. It's unfortunate for people who sleep late at night or who like to party late into the night, because they are not falling into the cycle that their normal circadian rhythm. And the circadian rhythm is different for different people. There are some people who are at their best in the early morning, and there are other people who are best in the night. So you have what they call as larks, who are very good in the early morning, and you have people who are known as owls, those who are, as they say, Raat ka Raja. But the point is, you can't change your genetic circadian rhythm. And if you try to change that circadian rhythm by changing your timings of work that clashes with your night or owl behavior, you will naturally experience the problems of lack of sleep. Therefore, it's in fact the thing that people are realizing now by working from home is they're able to work according to their circadian rhythm. Those who can work early in the morning, they get up early in the morning and get their work done. Those who work better later at night are able to resume their work, start work much later, and go on working later into the evening. Further, your body, because of its natural rhythms, has a best time to sleep. So if you do not sleep in that best time, you will be missing out quality sleep. And when we talk about having sleep of 8 hours, it means having quality sleep of 8 hours. And if you miss the crucial hours of sleep, and we will discuss what are those crucial hours of sleep, you will go through the day with this sleep deprivation. But you can see from this picture here that the body has its best times. The best coordination is afternoon. The best cardiovascular efficiency and strength is in the late afternoon. It's not a surprise that all the Olympic gold medals and those who shatter Olympic records are usually in this period of time. And the best period of time is, it starts in the evening at about 8:30, 9 o'clock, but it's best to be in bed by about 9:30, quarter to 10, because that's when your best time to sleep starts. And then the deepest part of sleep comes between 2 o'clock and perhaps 5 o'clock. And if you miss that time, then boy, you're in trouble. Sleep consists of different cycles. You have what we call as dream sleep and you have deep sleep. I will avoid the technical terms of rapid eye movement sleep and non-rapid eye movement sleep, but deep sleep is required for your body to rest. Deep sleep is required for your memory to be transferred from the hippocampus to your cortex. Deep sleep is required for your blood pressure to drop. It's required for your heart to get rest. It's required for your muscles to get rest. It's very, very important. It is the critical part of sleep. You also have a part of sleep which is called dream sleep. And dream sleep is also very, very important because dream sleep helps to resolve all the emotional trauma that you had during the day. They say that you sleep to remember and you sleep to forget. If you sleep before you learn something, you will learn better. If you sleep after you learn something, you'll retain what you've learned better. But the dream sleep that occurs in the early part of the morning is very important, because if you have any conflicts, if you have any problems, if you have any puzzles, if you have any challenging situations in your life, that first 55 minutes when you get up from your bed in the morning is the time when your brain is best equipped to resolve those issues. And this is because in dream sleep, a lot of wonderful things take place. First of all, in dream sleep, your stress hormones are prevented from acting on your brain. So noradrenaline does not act on your brain when you're in dream sleep. And you are allowed to recall all the traumatic events of the day without experiencing the emotional baggage that you would have carried forth. Therefore, you're able to experience the events without the emotion. And this helps you to lose the emotional baggage that you would normally carry. People who suffer from post-traumatic stress disorder or who carry emotional trauma with them are people who are unable to get into dream sleep in a proper manner and diffuse the emotion from their lives, which is an integral part of being sane. If you do not get to dream, then of course you're in trouble. And to illustrate this, I will take you to this novel called Valley of the Dolls. Valley of the Dolls was a best-selling book, and it became a best-selling movie also. And what are the dolls? If you can see on the cover of the book, the dolls are the tablets. What are those tablets? Those tablets are sleeping tablets. They are barbiturates. Now, what happens when you take barbiturates is that it suppresses the sleep, that is the dream sleep. And when your dream sleep is suppressed, what happens is that the emotional baggage that you're carrying keeps on increasing. And finally, people go mad. So dreaming is very important because dreaming helps you to diffuse the emotion from your life which you're carrying with you, and it actually helps you to remain sane. It helps you to solve the problems that you're dealing with in your life. Now, what about the help of alcohol? Why not have a drink every night before I go to sleep? It really helps me to get good sleep. Well, alcohol is a sedative, but alcohol also, my friends, is the suppressor of dream sleep. And because alcohol is a suppressor of dream sleep, first it becomes a habit, then it becomes an addiction. And by constantly suppressing dream sleep, finally you go into a psychosis which is known as delirium tremens. And in delirium tremens, those dreams start entering your waking life. You start having hallucinations. You start actually imagining all kinds of things. And therefore, you become totally mad. Taking alcohol suppresses dream sleep, and suppressing dream sleep is very, very bad for you. Therefore, I don't want to sound moralistic, but from the perspective of your mental health, it is better not to use alcohol as something that helps you to sleep. And that is something that almost 1/3 of people who are suffering from insomnia do. And they think that taking a glass of wine or having a beer or having a small drink in the evening will help you. My friends, this is actually having a very bad effect on your sleep, your dream sleep, and it is also having a bad effect on your mental health. In fact, especially if you're pregnant or you're lactating and you're taking even a glass of wine, you're suppressing the dream sleep of your baby. And the baby in the womb, the infant in the womb, it is so important for that baby to dream, because in the dream sleep that the baby has, that dream sleep actually helps the brain develop. So you're actually damaging the development of the baby in the womb when you take your glass of wine. And similarly, the baby requires a lot of dream sleep, much more than all of us, as it's growing up. And this is a strict no-no. What about coffee? Now, how does coffee act? Actually, what happens is that we go to sleep in the night because we have what is called a melatonin buildup. And this melatonin buildup tells the rest of our body that we need to go to sleep. And when we get up in the morning, when we start functioning in the daytime, we have, shall we say, a buildup of a substance known as adenosine. And caffeine is an adenosine receptor blocker. And therefore, it postpones your going to sleep. And since it postpones your going to sleep, I ask all of you to be mute, please, because I think something is disturbing. So,
Good.
Caffeine blocks your adenosine. It postpones your sleep time. It aggravates your sleep deprivation. As a matter of fact, if you need a cup of coffee to go through the day, then it probably means you're already suffering from lack of sleep. And that's why you need caffeine. It's better that you take time off and go to sleep, and then you come back when you're fresh. Because using caffeine is once again harmful for your sleep. What about the siesta? I got many questions on siesta. Should we take a siesta? Does it help? See, first of all, let me tell you that if you are robbing yourself of hours of sleep from your 8 hours sleep in the night, you are in trouble. Because the first part of your sleep is required to give your body, heart, mind, and your immune system good rest. The second part of your sleep, which is the shorter part of your sleep in the early morning, is required in order to help you solve problems, shed emotional baggage, etc. So you cannot make up a deficit in sleep. It cannot be that I will not sleep in the night, but I will catch up here and I'll catch up there and I'll do a power nap here or I'll do a power nap there. You might feel that you've caught up on sleep, but you never really catch up on sleep. Therefore, you cannot balance sleep by doing away with it in the night and trying to do some extra sleep in the daytime. Night sleep is vital. What about day sleep? What about siesta? Siesta is a very integral part of life in so many countries, including ours. And they have shown in Greece, for example, there was a Harvard study that when people did away with the siesta, there was almost a 37% increase in the number of heart attacks and strokes. So it's very, very important that you must get 30 to 60 minutes of sleep, because that 30 to 60 minutes of sleep, whether you do it in the form of your lunch break or whether you do it on the weekend, you should have a siesta. One of the problems with human beings is that why all of us are sleep deprived, at least 1/3 of us are sleep deprived. And the reason is because of incandescent lighting. And the bluer the light, the whiter the light, the more it disturbs our sleep cycle by fooling us into believing that it's not bedtime yet. Therefore, LED lights are the worst of the lot. White LED incandescent lights are the worst of the lot. So if you want to get good sleep, a good idea would be not to use white light or blue light in the evenings. In fact, you should use warm yellow light, if at all you want to have lights on in the late evening. And there are people who even use, you probably are aware that you get special glasses for driving at night, which reduces the glare of the oncoming headlights. Those are those yellow goggles. And those yellow goggles are worn by people who are very, very particular about getting their sleep, because by wearing the yellow goggles and filtering out the blue and white light, they are able to get good sleep. In fact, now we have LED lights that can change color. So you can have blue and white LED lights in the morning, and in the evening time, you can change the lighting to yellow and warmer shades, which are less likely to disturb your oncoming sleep. Your phone, your iPad, these are the biggest enemies, along with your television screen, your flat screen, are the greatest enemies of your sleep. Because if you are on the phone, if you are watching television, if you are watching your Netflix or your Amazon Prime or your daily news night TV, you are going to disturb your sleep. So ideally speaking, turn off all your social media. In fact, turn off your phone. Do not watch television before you go to bed. And the earlier you stop that in the evening, the better you will be able to sleep in the night. Many people say, how do I go to sleep? And that's a common question that's asked here. When you have stress, when you have negative thoughts, you have negative behaviors. So this short talk is not sufficient to explain how you can diffuse negative thoughts and behaviors. I think I've done some of that in my earlier talk on emotional intelligence. But I'd like to tell you very briefly that there is a form of therapy which is specially directed towards insomnia. This is called cognitive behavioral therapy insomnia. And this cognitive behavioral therapy insomnia is directed towards changing your emotions and changing your behavior. And if you are talking to a therapist, be sure that this is what you want, because CBTI, or cognitive behavioral therapy insomnia, is what really helps you in order to become free from disturbing and intrusive thoughts that prevent you from falling off to sleep. So to tackle your insomnia problems, you need to establish a good environment. So dim your lights. You should keep a fixed bedtime so that at least during the week, and preferably during the weekends too, you should have a fixed bedtime and a fixed rising time. Don't think that because it's a weekend I can sleep late and I can get up late. That disturbs the whole sleep cycle. So whether it's a weekday or it's a weekend, learn to sleep at the same time and learn to get up at the same time. Don't use an alarm. You must be able to get up by yourself when your natural sleep comes to a conclusion. If you need an alarm, you probably need to sleep earlier. You have a built-in alarm clock, and that built-in alarm clock will wake you up when you had sufficient sleep. When you are going to sleep, please understand that the temperature of your room has a very large say in how quickly you go to sleep. The ideal temperature for sleeping is about 18.5 degrees. So if you are fortunate to have climate control or an air conditioner, make sure your temperature is about 18.5. Try to take a shower before you go to bed. And after a warm shower, get into bed in a cool room, cover yourself well, because as your core body temperature drops, you fall off to sleep much faster. Do not watch television, do not watch your iPod, iPad, your iPhones in the evenings. Turn that off. Don't sleep after a very heavy meal. As you grow older, you will find that more and more people have reflux esophagitis. They have heartburn. And after the age of 50, almost half the people have heartburn. Even though they may not be aware of it, it is chemically acting on them. Therefore, it's very important that you should not have a very heavy meal just before you go to sleep. There should be a gap of 2 to 3 hours before you go to bed after your last heavy meal. Further, you should undertake some exercise, but not too close to bedtime. Because if you exercise close to bedtime, your temperature, core temperature goes up. And as your core temperature goes up, you have greater difficulty in having sleep. But during the day, you should have sufficient exercise that in the evening you are able to sleep well. So if you are having intrusive thoughts or you're having stress in your life, you should go for cognitive behavioral therapy that is specifically directed towards insomnia. Performing yoga asanas, breathing exercises, meditation, all of these are simply wonderful for tackling insomnia. So I will stop this presentation here and I will ask you if you have any queries or questions which I can take. If there aren't any questions that come up, I will take up the questions that have already come to me so far.
Doctor,
Yes.
first, thank you so much for this. It's enlightening. There are so many things that you talk in there. I was just playing the tape in my head. A lot of the mistakes that you indicated that people do, I have done. And some I still do today. And we have discussed this as well. Extremely enlightening, very valuable. Thank you so much. I ask every one of you to keep your question ready, and then one by one you can ask them. Doctor, I'll pose a question to kick this off.
Sure.
And I'm sure this question would not be just from me. I'm sure many people have the same thoughts. And I'm speaking some of it, showing you my own challenges, my own constraints. For the longest time in my life, I have not slept more than 4 or 5 hours. Okay? I've come from a background where if we slept more, that was considered evil, that you're not sharp. You've got to study more, read more, learn more, become smart. Now that is programmed as a child. And you grow up. I've grown up into it. And when one has to keep 2 jobs when growing up, when one is young and doing all those constraints, and one gets programmed into it, one has responsibilities, family, work, challenges at home, challenges for the extended family, education. You don't want to be dumb. Somebody asked me a question about a wide-body jet. I should know. Somebody asked me something about COVID. I should know. How could I be dumb? Now, to be knowledgeable takes time. Even to this day, I read 3 hours a night. I struggle with all this, trying to get enough sleep. And I'm sure I'm representing multiple people on this panel when I ask this question, because everybody has their own challenges. Doctor, kindly tell us on a practical basis, realistically, practically, most of us, you said that in developed countries, people don't get enough sleep. And I assume it's the same in developing countries or in India for that matter. And with all these, every new iPhone, 1.5 lakh rupees, every new car, 50 lakh rupees, you want more and more and more. When you want more and more, you want to work more and more. You can't dramatically become jobs and smarter overnight. So you try harder, you work harder to achieve more, and you struggle. So is this sleep thing a trade-off between our aspirations and what we really need? Is there a central problem on top there in our system, in our society, in our culture, across the world? Or is this something that we have to take control individually and some of us will do much better than the other? Is it a societal problem or is it an individual problem? How do you see us come up with a practical fix?
Well, I'd like to say that it's an individual problem, because how much we sleep is largely dependent on each individual person who decides how to prioritize sleep in his life or her life. And while it is necessary to sleep, one should not think that one loses out by going to sleep. They have shown, for example, in schools, that when schools have reduced their early morning hours, the children have increased their SAT scores. They've shown in large corporations in the Fortune 500 that when they allow their executives to have sufficient sleep, their engagement is greater, their problem solving is greater. And while it might not look so good on the time clocks which you punch, the fact is that these people get greater work done. They are more creative. They are more energetic, and they're more driven to get their work completed. So work, I mean, going to sleep does not compromise your work. It adds an edge to your work. It helps you to work better. So the data shows, or the science shows, that if you have sufficient sleep, your work has to improve, your productivity has to improve, and indeed, the cooperation does much better when you have sufficient sleep. It's not for no reason that the best corporations in the world, which are a delight to work for example, Google or Facebook, they have sleep pods in their workplace. So instead of having people coming around and saying, why are you sleeping here? Why are you dozing off? In fact, they have sleep pods where you're supposed to go and sleep and, get good rest so that your mind is completely refreshed and you can come back to work and become far more productive. It's not the hours you put into it that's important. It's the quality of the hours that you put into it. And increasingly, it is now recognized in corporations, in educational institutions, that sleep is integral to productivity, creativity, problem solving, and better performance.
Great. I thank you very much for giving those examples as well. I really, really appreciate it. Now let's just open it up to the group.
Yeah, so there is one question that has come to me. I would like to know about Yog Nidra. Yog Nidra is really a guided relaxation meditation. Hello?
Everybody kindly mute, please, so doctor can speak without being interrupted. Thank you.
So Yog Nidra is about a guided relaxation meditation. It was popularized by the Bihar School of Yoga, and it helps to bring about a meditative state where progressive muscular relaxation brings you into a deep state of altered state of consciousness. It's very good, it's wonderful, it's not a substitute for sleep. However, if you are able to do Yog Nidra once or twice in the day, then this Yog Nidra enables you to get large amount of rest. In fact, your body temperature, your metabolic rate, everything drops considerably in Yog Nidra, and it is a recommended form of meditation for people suffering from panic disorders and anxiety disorders. Is that all right? Is that answer okay for you, Harshada?
Yes, sir. Thank you so much.
So we have another question from Parag Zade. Yes, one is the question he has submitted and one is a question he's asked now. He says, how to manage during night shifts? Well, as I said, night shifts are an unfortunate part of life, and we hope that you don't have to do night shifts all the time. When, as a surgeon, I had to do a residency, we had night shifts. When my son had to do his residency, he also had to do nights. And these wreak havoc with your health. You can't help it, but that's a part of life. But definitely you can't say that night shift is a good part of your health program. It is definitely deleterious to your health. As I said, you cannot compensate for the quality sleep you get at night, but try to get as much sleep as you can during the day. It is not a full substitute for sleeping at night, however. Mr. Parag, does that answer your question? Are you there, Mr. Parag?
Yes, sir.
Okay. You also asked how the body works to remove toxins during sleep or how it refreshes. I hope my presentation has already covered that. Is that
Yes,
right?
sir. Yes, sir.
Doctor, this is Betty Saldana. My body seems to need about 9.5 to 10 hours of sleep a night, which I get.
Yes.
And when I get the 9.5 to 10, I feel very refreshed to take my morning walk. Is that too much? Is there such a thing as having too much sleep?
Well, there have been some studies which have been proven to be not properly conducted, which at some time suggested that too much sleep might be harmful. But those studies were conducted in people who were suffering from depressive disorders, those people who were already ill and lying in bed. But for a normal person,
Yes.
it is not possible to sleep too much.
Okay, good.
If you're a normal human being who doesn't have any chronic diseases that could
No,
cause sleeplessness, then
no.
it's wonderful that you can sleep 9 hours. Good luck to you, and I
9.5
hope
to
more
10.
of you can follow in, more people can follow your example.
Okay, thank you.
So I have a question from Gaurav Batra. That can you answer the question I submitted earlier about my mother pre-session? She is 71, a homemaker and a workaholic. She doesn't rest and she cannot sleep. Well, I'll share with you, Mr. Gaurav Batra, that my late father in his 70s also had difficulty in sleeping. And I put him onto an exercise program and I helped him to do assisted lifting of heavy weights. And by doing exercise, he got wonderful, wonderful sleep. So I would strongly suggest that a lot of people who don't get sleep don't take sufficient exercise. So you should definitely take exercise, whether it's a vigorous walk, whether you can do progressive resistance exercises. If you can do this and your body really gets tired out, then you will sleep very, very naturally. So Gaurav Batra, I hope this answers your question.
Oh, thanks, Doc. She actually does a lot of yoga.
Yoga is not exercise.
Okay.
Yoga is a relaxation technique.
Okay, sure.
Unless you're doing, uh, you know, Ashtang Yoga, which is a gymnastic kind of yoga. So if she's not doing that, then yoga is not sufficient. She needs to do, see, an ideal exercise program should have coordination and balance, which is very important for older people because they tend to overbalance, they tend to fall down. So coordination and balance exercises are important. You also need progressive resistance exercise. We need progressive resistance exercise because you tend to get sarcopenia or loss of muscle mass. And therefore, by lifting weights, even if it is in homes for the aged, even lifting heavy utensils or heavy spoons, even that is advantageous. So you need progressive resistance exercise. And then, of course, you need aerobic exercise. Yoga is none of these. Though yoga is, of course, an excellent way to bring about stretch and relaxation. So that's one more component of exercise. Does it answer your question?
Yes, doctor. Thank you so much.
Yeah. So there's a question from BK to me that if we are much in the spiritual path, our need is reduced, like less food, less thoughts, living sattvic life, and taking lesser sleep. Lesser sleep is not an option. I don't care how spiritual you are, if you do not get adequate sleep, the 7 to 9 hours of sleep that all normal human beings require. No matter how spiritual you are, you have to have 7 to 9 hours of sleep. If you're not getting that, then you better start doing something about it. I've given some pointers on how to get good sleep, but you must have 7 to 9 hours of sleep every night. A siesta is good, as I told you, because they have shown that people who take 1 hour siesta in the afternoon are the most likely to live beyond 90 years of age. So siesta is wonderful. Does it answer your question, BK?
Yes, doctor. Thank you.
So I'll go on to some of the other questions that have already been submitted to me. Aparna Thakur has asked me a question that When you can't get sound sleep and something is continuously bothering your mind, I've already discussed that you need therapy. Using cognitive behavioral therapy for insomnia is a very important part of keeping your mind in order and helping you to sleep well. Aparna, are you there? Hello. I hope it means that she's asleep already. Shivaji Bagal, does 7 hours sleep sufficient in the night or it requires a power nap in the afternoon? Also, every night I wander here and there in dreams, and when I wake up, I don't remember the dreams. I've already explained the cycle of non-dream sleep or deep sleep and dream sleep. And I've also explained the number of hours that are required to sleep every night. Laura D'Souza. Laura D'Souza says, if the body is already accustomed to 6 hours of sleep, should one still try to change it? The answer is yes. You need 7 to 9 hours of sleep. So please try to adjust your sleep so that you get 7 to 9 hours of sleep. And if you do that, you will find that many of your health issues will begin to sort themselves automatically. You will reach your normal body weight, your sugars will return from pre-diabetic to normal, and you will get a much happier, healthier emotional life. Laura, are you there? Arjun B has asked the question, how do we fall asleep in a short time and how can we have a pleasant? You can fall asleep in a short time if you follow all the guidances I've given for dealing with insomnia, keeping the right temperature in your bedroom, keeping a fixed time for going to bed and getting up, avoiding coffee after midday, not taking alcohol, which will spoil the quality of your sleep, engaging in cognitive behavioral therapy for insomnia. All of these will help. Arjun B, are you there? Vijayanand Kulkarni, are you there? I'll call out the name. If you're not there, I'm not answering your question. Most of it has already been covered in the Sachin Patwardhan. Are you there?
Yes, sir.
So your question is how to overcome sleep disorder and adjust sleep when professional working hours extend till late in the night. Well, as far as possible, you should try to adjust your working hours, and you should try to reduce your working hours or adjust your working hours so that you get adequate sleep. Sleep is very, very important. The hours at work actually suffer in quality, and your work is not as efficiently done if you do not get sufficient sleep. It's very important that you try to sleep an adequate number of hours.
May I one question?
Yes.
I go to sleep by 10 o'clock, but then I get up for 4 o'clock for a Brahma Muhurat for doing meditation. And again,
You must have 8 hours of sleep.
Yes, then again I go to sleep for 2 hours.
No, you have full 8 hours of sleep.
Okay.
You must have 8 hours of sleep minimum. Yeah. If you need to go to sleep after you have woken up, it means that you are sleep deprived. You have a problem. Therefore, you need to sleep full 8 hours. Yes.
Sir, I have a question.
Yes.
Actually, I do get proper sleep, but this is a question from my wife that when she sleeps, she is saying that she is unable to listen. She is able to listen her snoring noise also, and also she is able to listen the surrounding sounds. The surrounding sounds, I mean. So, what does it mean, sir?
Snoring sounds are a problem because snoring means that you should subject yourself to a sleep lab test in case you're suffering from sleep apnea, which itself is an independent cause for heart disease. So snoring If your husband is snoring, please send him to a sleep lab, get him checked out. He may require a CPAP machine and he may require treatment. So snoring must be treated adequately. And when you are listening to somebody snoring, you are obviously disturbed by other sounds. So please take care of the snoring of your partner and automatically other things will settle down.
Anil Lambo here. I want to ask a question.
Yes, sure.
I go to sleep at around 10 o'clock. I mean, go to bed about quarter to 10, 10. By
Yes.
10, I'm fast asleep. I mean, I have no
By-
problem falling to
By
sleep.
10 what?
In a 5 or 10 minutes, I fall asleep. No issues.
Excellent, excellent,
After you sleep within 10 minutes, you're fast asleep perfectly. Now the question,
excellent.
I get at 4:35, I get up. Now that's not 8 hours. So I have put an alarm for 4:45, 4:50. But now supposing I get up and it's not 8 hours, should I just lie in bed? What should I do? Because if I sleep at 10 or by 10:10, I'm fast asleep. And at 4:30, then I'm restless in bed. So that's only 7 hours or 6 hours or 6 or 7 hours. 4:30.
So 7 to 9 hours is sufficient. But if you get 8 hours to 9 hours, that's even better. If you are, first thing is don't use an alarm, please.
Don't use alarm, okay.
Don't use an alarm.
Get up before the alarm.
Alarm, throw all the alarms that you have in your house out of the window.
No,
provided there's no one below your window.
Usually I put an alarm for 4:59, but by 4:45 I'm wide awake.
No, don't put an alarm. Please understand that. Don't put an alarm. You must let your natural sleep reach its natural conclusion. Do not use an alarm.
I got that.
If you require an alarm, you need to sleep earlier.
Okay, I need to understand one thing now. I've not put an alarm, but after 6.5 hours, if I am getting up and I'm not able to go back to sleep, what should I do? I shouldn't get up. What I think is I get up, I have a bath, do my prayers, I go for a walk, and I come back and sleep for half an hour, 1 hour.
It's better if you sleep earlier in the night. Then you won't need to go back to sleep after getting up once in a month.
If I go to sleep before 10 o'clock, my wife will run away because she says already.
I don't think your wife will run away.
No, but at 10 o'clock.
Maybe she should go to sleep at the same time.
No, she goes to sleep at 12 o'clock. So I'm not worried about her. I'm concerned about myself right now. And I go to sleep at 10 o'clock.
No, so you please sleep at 9 o'clock then, and you see whether you need to go to sleep again. You should have unbroken sleep of 7 to 9 hours.
Okay, so supposing I go, now answer this question. If after 6.5 hours, I break, whether I sleep at 9 or 10. If I sleep at 10 and I get up at, say about 4:45, 4:35, 7.
See, you're still using an alarm. I suggest you stop using the alarm. Then you can always email me and I'll answer your question.
Yes, I think it's best if you email doctor to get something specific, because we have a large number of people. So it'll be good if doctor can for multiple people. Yeah, because we're already past an hour. So if we can move on to the next one.
We need the email ID.
We'll get it to you. We'll get it to you.
Thank you.
Thank you. Doctor, any other questions? Any other questions for doctor?
I think most of the questions that have been asked earlier, someone has asked how long should a toddler sleep? That's also been covered in my presentation.
Yes.
Doctor, I have one question to ask.
Yes, who's this?
Harshal.
Yes.
Doctor, there are days, especially now in these times when one is working from home, there's anyways a lot of stress because you're doing a lot of housework as well and focusing on so many other things, and plus you are so busy with a lot of office stuff, and we tend to have long meetings because there's too much of screen time now. There are times when I feel extremely tired, and it's like, by 7 I just want to, I keep telling myself I just need to sleep right now, I just need to crash. But then when I actually, get down to sleeping, I don't get sleep. I'm wide awake for a very long time. I mean, I know I'm tired. I'm really tired. My back is hurting because I'm constantly sitting. So all of that. So is it normal, doctor, that I feel very tired, but I don't get sleep and I'm wide awake? and I know that I have to sleep. Like I have to tell myself that now you have to sleep because tomorrow is again a busy day. Meetings start by 10 in the morning, so I have to get my 8 hours of sleep.
See, your difficulties in getting to sleep are only because you are not able to turn off your mind. Thoughts are racing through your mind, and these thoughts that are racing through your mind prevent you from sleeping. The solution for this is to have cognitive behavioral therapy for insomnia. In the times we have access to therapists who are available, please log in and take their advice on cognitive behavioral therapy for insomnia.
All right, doctor, but it's just on few days. It's not every day in the week, maybe just sometimes. So, but you still suggest that one needs to talk to a therapist and.
Yeah, it's always better to talk to a therapist.
Okay.
When
Maybe I'm not able to.
When HR is offering you that service, why not take the opportunity?
I'm with HR, by the way.
Yeah, so then you should know that we have the facilities.
Yeah.
What's your name?
Harshal.
Yeah, okay.
Thank you.
Yeah, sure. Yes?
Any other questions for doctor?
Doctor, I have a question. My name is Justina. I have a question. What should be the duration required for a deep sleep and a light sleep?
You require 8 hours of sleep and let your body make all the adjustments, how much deep sleep you require and how much dream sleep you require. That is automatically taken care of. You have no control over it.
Okay,
all you have control over is whether you get your 7 to 9 hours of sleep. And if you get those 7 to 9 hours of sleep, you will not have any issues whatsoever.
Okay.
There's a question from Rohit Parikh here, that any tips for new parents, how to manage sleep with a newborn kid who keeps making the parents awake? Well, that's a very unfortunate state because, the circadian rhythm of the child, newborn child, is that it sleeps in snatches. And because it sleeps in snatches, it needs frequent sleep and frequent wake-ups. So anybody who's looking after that child will be having sleeplessness. So the best thing you can do, Rohit, is that if you can hire somebody who will look after the child in the night time. So if you can get a night nurse, or you can get a night person who can look after the child in the night, that would be the best thing that you can do. I hope that answers your question.
Yeah, Doc, it does. But I think in COVID times that would be difficult, right?
Possible.
Well, get them tested out. We have enough laboratories that are doing the COVID tests. So get that tested out and show that report that they're COVID free to your society. And if you can keep them full time, then you're exposing the chances of getting infected outside.
Yeah.
And in any case, your baby is not going to get infected by COVID. So that's not a problem.
Doctor, I have a
So
question.
Rajesh has asked a question. Is there a relationship between good digestion and good sleep and vice versa? Yes, between good sleep, good digestion, good cardiovascular health, good metabolic system, all of these are connected with good sleep. So you will get good digestion if you have good sleep. But of course, you can't abuse your digestion by taking foods that are not appropriate for it. But good sleep will definitely help your digestion. Please see that you do not sleep after a very heavy meal. If you sleep and you become horizontal after a very heavy meal, you are increasing the risk of abdominal pressure, especially when you turn over on your abdomen. You can get reflux esophagitis if you are older than 45. And these issues can also create a health problem for you. Does that answer your question, Rajesh? Yeah. Arun, you have some question? Mr. Harun.
Doctor, I'd like to ask a question.
Yes.
This is Sanju here. You mentioned about the room temperature, that ideal temperature should be around 18.5. So how
Yes.
is it related? If you would delve more, how is it related to good sleep?
See, what happens is that your body temperature, your core body temperature falls when you're going to sleep. It's a signal to the rest of your body that I am going to sleep. That's why this core body temperature drops. So if you are sleeping in a room with 18.5 degrees temperature, scientifically they have shown that you tend to fall asleep faster. This is based upon data and science.
Okay, thank you.
Yes.
Hi, Doc. This is Harun here.
Yeah. Yes, Harun.
Yes. What would be the best time for siesta or afternoon sleep, considering our normal working hours, and for how much time it should be done?
Well, normal siesta should not be more than 60 minutes. And if you can do that instead of your lunch hour, that's a good idea.
And so, does it make a part of 7 to 9 hours sleep, which you have suggested?
No, that is separate.
Okay, sir. Thank you very much.
7 to 9 hours sleep is non-negotiable.
Okay, sir.
I have a question from, I am working in production department of the Times of India. So we have to do night shift always.
Yes.
So our duty schedule is accordingly, we have a shift rotation. So we have a 7 days night and 7 days day, or maybe we have 15 days night or 15 days day. So our body is not used to this situation of getting a good sleep. I mean, so can you suggest us?
Well, it's unfortunate if you have to work night shifts. It's not a good way to maintain good health and good sleep. So I hope that this is not the, you can make some adjustment in your life. And usually for doctors who have to do night shifts, that's a phase in their career. And after some time, we move to a period of life where other people move into the jobs where night shifts have to be done. So that's what's happened to me. That's what's happened to my son. And I would strongly suggest people who have to work on night shifts, don't make this a permanent part of your life. Harun has asked, can you share these guidelines on email? What I will do is that I will share these with the HR, then HR can make them available to everybody.
Good.
And Anantapurkar has asked, many thoughts disturb your sleep, for which I have told you that you please go to CBT Insomnia, and learn cognitive behavioral therapy for insomnia. We have in the Times group counseling facilities. Please make use of them. Srinivas Korada is asking, do we get good sleep by listening to music? I don't know. I don't. I get good sleep by having silence in my room. It's possible some people may get good sleep. Babies get certainly better sleep when they have lullabies. I have no information about this.
Thank you, doctor.
Anyone else?
Hello.
Yes. Yes.
Actually, just now you told that siesta.
Yes.
But after getting half hour 1 hour sleep in afternoon, I did not get full sleep in the night. My sleep get reduced to 1 hour or 2 hours. If I sleep at half an hour afternoon.
How much exercise you take?
20 minutes to half an hour.
Of what?
Just running and doing sit-ups and all this.
So you should have 7 to 9 hours sleep at night, and if you can, if it's possible, if your work allows you, have 1 hour sleep in the afternoon.
Okay. Okay, thank you.
Yes, anyone else?
Doctor, you've been very kind to take so many questions from us and wake up so early. And many of you, we have now entered the dinner time in India, and you have given us all a lot of information, a lot of useful information. I'm processing it in my little head myself about when I'll go to bed tonight. So we are all in your debt. Thank you so much. And I'm sure people have some more questions. When you prepare something, a couple pages or what have you, which will be available through HR for everybody regarding sleep, it'll be useful. From the questions, it is quite clear that many people are thinking about this. This is a pressing topic for many of us. We might not spend a lot of time actively thinking about it, but listening to you today has made me and many of us think actively about it, and that perhaps is the best way to start action. Do something different to get better. I'm going to do something different from tonight, and thank you for it. I'm sure I'm carrying everybody's thanks. 700 some people all thanking you. I thank you very much on behalf of the teams, people on this call, and people who will be reading what you're going to put out there. Thank you very much. Appreciate the time.
Thank you, everybody. And I wish all of you a good night's sleep tonight and every night thereafter. Thank you.
Thank you, Doctor.
Thank you, doctor. Thank you very much.